Good evening and a happy 2022 to you. Welcome to All About Money. I'm your host, Dhruv Tkekar. As the dust settles from the conclusion of a landmark trial that rocked Silicon Valley and spanned months, this week we're going to be looking at what went wrong with Theranos. That's the controversial blood testing company established by Elizabeth Holmes, who was found guilty on 4 counts of fraud. She had claimed that her company had come up with technology that could accurately and reliably test for a number of conditions using just a few drops of blood taken from a finger prick, but that was later found to not be true. Well, joining me from the U.S. to talk about this is Ana Santos Rutschman. She's an assistant professor of law at St. Louis University, whose areas of focus include health law and intellectual property. Ana, thank you so much for joining us.
Thank you for having me.
Obviously, I gave a very brief overview of what's been happening so far, over the controversy, rather, that has been spanning years now. Maybe you could take us back a little bit to how it all began. How, quote unquote, I suppose, successful did Theranos get, and just how close was it to actually rolling out these devices on a wider scale around the U.S.?
Well, they actually did roll out the devices. There were about 40 locations in Arizona and a couple other places where these tests, they're really diagnostics, were actually deployed and made available to patients. So I don't know if I would use the word success in this context because Theranos was not really providing functioning tests, but they did come to patients, not on a widespread level, but they did come to market, and Theranos actually inked multiple deals with big companies that were going to use this technology. So, and this was almost 10 years ago, and the science was just not there. But they did succeed in that sense in bringing these products to market under extremely faulty conditions.
I did want to get to the brands or deals that they'd actually made later down the line, but when did these claims actually start raising eyebrows? When did people start maybe giving it a second look and sort of wondering what exactly went wrong over here?
I mean, there were doubts from early on. So the company was founded in 2003 with Elizabeth Holmes famously dropping off of Stanford in 2004. And there was about almost a decade, I would say, in which the technology allegedly was being developed. And for sure, there was work going at Theranos, just not exactly under the conditions they were claiming they were developing the technology. And then around 2013, 2014, that's the 40 locations in Arizona that I was talking about, the really, eyebrow-raising deals that Theranos started engaging in. That's in 2013, 2014. And with those deals came greater exposure, and with greater exposure, more and more people started questioning the science behind the devices themselves, the diagnostic tests, and the claims made by Holmes, and not just by Elizabeth Holmes, right? Because Theranos was not just Elizabeth Holmes, but the company came under more intense scrutiny around 2013, 2014, even though internally there were a lot of people already very concerned about what was happening at Theranos well before that.
I briefly mentioned, obviously, the claims that they'd made, but maybe you could give us a little more details about what exactly this device was and how it functioned.
So there were basically two things that Theranos was developing, claiming to develop, but it boiled down to this idea that right now, if you want or if you need to be tested for, say, 5 different conditions or diseases, you have to probably have a lot of blood drawn. And Elizabeth Holmes' initial idea was that with just a tiny drop of blood, we'll prick your finger and that's it. We are going to be able to test for a multitude of different diseases, etc. So the company was advertising over 100 tests they could perform, and you would just literally need a drop of blood, which would be wonderful if we could have that. It's just the science is not there yet. And they had a device that would perform, if not all, at least a lot of these tests, and then they had the tests themselves. So there was a couple of different components from a technology perspective that were involved in all of this. But the gist of the operation, so to speak, was that the drop of blood will allow for very efficient, low-cost, quick testing for a wide array of diseases.
And speaking of the science not being in place for this, was there any peer-reviewed research that went into the development of this device, or how exactly was the pre-market review of it done?
So that's a large piece of the puzzle, and the trial that just now came to an end, or at least this stage of the legal proceedings, it was really not about that. It was all about the representations made by Elizabeth Holmes and other people who worked in the company. But really, part of the puzzle here is that under current law in the United States, really these devices don't have to have any type of pre-market review on part of the Food, Drug, and Administration, which otherwise will examine most new devices, medical devices that do come to market. And this has to do with the very, very long legal tradition at this point in the US. The FDA started regulating medical devices in the mid-70s, but decided to do something called exercising enforcement discretion. So saying we have the ability to regulate these devices, but we're not going to do it. And that has not changed. So FDA could, in theory, be looking at these devices before they enter the market, but is not doing that.
And during the trial stages of products like these in the U.S. in particular, are they designed with the intention of identifying problems or shortfalls in the technology, or is that, I suppose, skipped over when it comes to the distribution or ultimately when it goes to the market?
So under a system of enforcement discretion, what it means is that the product can come to market. You had actually asked me about peer review. There's no requirement, other than according to scientific principles, there's no requirement that there be a peer-reviewed article or multiple articles before something that is not subject to regulation comes to market. So that's what the trial really wasn't about. But I think it's probably one of the most problematic things in all of the Theranos story and the history of the company and what they claimed to do and how they brought these tests these faulty tests to these locations is precisely that there was nobody other than the company itself that fully know what was going on or even had an idea of what was going on. So there were two things missing. There was the peer review component, which for most medical devices, drugs, you tend to have, right, to some extent. And here it was absent. But again, this is not illegal. This is how the system currently functions. And there was the absence of the regulator, in this particular case, the FDA, which had very minimal contact with the company, again, by design.
Speaking of the locations that it ultimately got to, Walgreens bought a lot of these devices and put them on their shelves without verifying the technology, obviously. Is it incumbent then on them to check to see whether these devices are serving the function that they're supposed to serve? And should there be legislation in place that prevents companies with the scale and reputation of Walgreens, for example, that obviously can endorse or support products like these to maybe rein it in a little bit?
Well, I think that it's very clear to me and to a lot of commentators out there that there has to be some sort of scrutiny, right? I'm a law professor, so I think that the type of scrutiny that makes the most sense is by the regulator of medical devices. The laboratories themselves are regulated separately, so the centers for Medicare and Medicaid do some work there. But if you're talking about medical technologies, we're really talking about the FDA. So and FDA has the legal authority to do this. They just have chosen back in time not to do it because when FDA started regulating these types of technologies, they were very simple. There were not a lot of laboratory developed tests, which is all the things I've been talking about. That's the regulatory category this all falls under. This was a very simple technology, and there might be some very good reasons for an agency to say we're not going to stifle innovation in this area, that we don't see a big risk, but it's not 1976 anymore. So I think this should fall to the FDA, and I think FDA should not be exercising its enforcement discretion here. But I would not put the burden of checking something of this nature on companies like Walgreens or other similar companies. It's obvious that they have some duties vis-a-vis the patients that they serve, right? That's part of the business model. But asking these companies to validate, medical diagnostics to provide that type of data, I don't think they're the best players in the ecosystem. I think that ought to go to somebody with much more expertise, with much more tradition in this area. That's not the company itself, right? Not Theranos vouching for its own technology. So again, we go back to FDA, in my opinion.
So when it comes to that point, actually, when it comes to then regulatory oversight of, say, for example, the distribution of these devices, should there be the same level of oversight for the distribution as there should be for perhaps the peer review and the checking of the devices before they actually go to the markets?
Well, the two kind of go hand in hand, right? You basically, the problem with these tests being false is that we're trying for a diagnostic. So basically, what do we want? We want to know if, the bacterium is present or not, right? We want to know if somebody's at the heightened risk for a particular type of cancer, for instance, right? And the problem is going to be whether the bulk of the problem is the result produced by the test accurate, right? So we're talking about clinical validity of the test. So I really think that's, if you fix that's basically an enormous gain from a public health perspective and from a regulatory perspective. So I would maintain that we need to fix it before it gets to the distribution level. These are medical devices. We know how to do pre-market review of medical devices. Granted, there are loopholes in the law in other areas. There are ways in which some companies have evaded the more stringent forms of regulation for medical devices by relying on something that's already available to patients, for instance. That's not quite the same, and they keep relying on a chain of predicate devices, for instance. So there's some ways you can get around the laws as structured, but I think those are outlier examples. I think, as a rule, we know how to subject things like diagnostics to pre-market review. We're just not enforcing it. And again, if FDA did that, then I have much less concern, fewer concerns with the distribution stage and who might be at fault at that point. Then keep in mind that the laboratories themselves are regulated as well. So again, FDA plus lab regulation, in my mind, would afford enough protection in this area.
And obviously a lot more to get to, but we do have to go to a quick break. Stay tuned, we'll be right back.